as we're looking here, all I want to do is I want to identify where that sacral sulcus is, right? So here's the sacrum here, okay? Sorry, it's pink. Colin, is that a problem? Awesome. So as he slumps, I'm just going to feel for what's happening. My theory is that it does this, but you guys can, I'll leave that to you guys to kind of think about that. And as he kind of extends and goes into extension, that sacrum is going to kind of go the other way, right? So all I'm going to do is I'm going to feel PSISCs again. So if you haven't gotten the message by now, it's important to be able to find the PSISCs, okay? Find those PSISCs, easy to find on him, and then I just drop in about 1/4 of an inch. So now I should be over the sacral sulcus. If I'm above that, I'm in lumbar spine. If I'm below that, I'm more toward the apex of that sacrum. So I'm just dropping medially, and your fingers are kind of close to each other. They're not far apart, okay? Because that sacrum is broad, but it's not that broad. And I'm just basically feeling for this, and I'm going to have them slump. Now, when a patient slumps, what you got to make sure they're doing is truly slumping. What I really want him doing is bringing his pelvis into posterior rotation and slumping, right? Some patients will lean forward, right? I really want slump. I want a slump going on, okay? So I'm in here like this, I'm palpating, and go ahead and slump for me. And he'll slump, I'll feel what's going on there, and now go all the way the other way and sit up kind of and extend for me. Good. Now when he extends, it's harder to feel because you're feeling through muscle that's working. And now go ahead and slump again, right? And now go ahead and extend all the way. Good. Now sometimes I'll just have him do a couple extensions or a couple slumps. Sometimes I'll go from one extreme to the other. And I'm just kind of feeling for that motion as he's doing it. And I'm asking him if there's any symptoms. If he says it hurts when he goes up, but it feels better when he slumps, that gives me information. Or vice versa. Some of you guys, when you were doing this, you had pain, right? So it's important to identify what direction the pain occurs in. And that's all I'm doing. I'm trying to get a sense of motion. Okay? Now, what we can move right into here is we can talk about rotation. Now, we know the sacrum moves in a triplanar fashion, but by far and away, it primarily moves in the sagittal plane. But the sacrum, we can appreciate, also moves into rotation. So as you're sitting there now, feel your sacral sulci again. And now I want you to just rotate to the right and to the left. And you should be feeling that sacrum, and my theory on this is that it moves with your lumbar spine. It moves in the same direction in this transverse plane. Okay? So with this test, the sitting rotation test, I'm at the same exact spot on the sacral sulci, and I have them rotate to the right, and I have them rotate to the left. And I'm feeling for what's going on with their sacral sulci. So as he rotates to the left, I feel the left sulcus become more prominent. As he rotates to the right sulcus becomes more prominent. I'm just looking at sacral motion again in another plane. That's all I'm doing. By far and away, the sit to slump, I think, gives you a better sense of how it's moving because the sacrum is primarily moving in the sagittal plane. But this, again, is just another piece of information. And I'll show you how we can then use that relative to symptoms. Okay, so that's sit-slump test, sitting rotation test. Now we've looked at sacroiliac motion along with iliosacral motion. So now we've got the pelvic girdle kind of under our belts, so to speak, literally, in regards to motion. Okay? Any questions?